Joss, what's going on?
My ear kind of hurts.
Oh, your ear. All right, we should do a telehealth. Let's go visit Mommy's computer and talk to the doctor.
Okay. Hello?
Hi, Jessica. Can you see me okay?
I can.
Hi, I'm Dr. Elbawi. Nice to meet you.
Hi, nice to meet you.
Is this Jocelyn?
Yeah.
Hi, Jocelyn. I heard you're feeling sick.
Yeah.
What's hurting you? Your ear? I see. Okay. How long has it been bothering you?
This long?
That long? Like a couple days? Okay. All right. What's going on, Jessica? Has she been complaining about anything else?
No, really just her ear. She started pulling a little bit. I asked her, what's going on, what's bothering her, and it's her ear, so.
Got you. Well, I'm glad you called, and let's use your Tyto device now to take a close look at her ear. So I'll have you place it in her ear canal so we can take a close look.
Okay, I'm attaching.
Perfect. You'll use the otoscope tip. That's exactly the one.
Attaching it. I'm putting this tip on, right?
Exactly.
Mm-hmm. Okay.
All right.
Let's see.
You see that the light's on now, and that's perfect.
Is that the right angle?
Yeah, tilt it down just a bit. That's perfect. Exactly. Great. Hold it there for a second. Okay. Very good. Thank you, Jessica. Yeah, so it looks like the eardrum is red, and there's a little bit of pus behind it as well. So it does look like it's an ear infection that should respond very well to antibiotics. Does she have any allergies?
No.
No. Okay.
None.
Okay, good. So we'll start some antibiotics for her. I'll send that to your pharmacy. And please let us know if she's not getting better over the next couple days, or if she starts to complain of anything or worsening pain, let us know. But you can continue to use Tylenol or Motrin to help her for her discomfort.
Okay, great. Thank you.
Yeah, absolutely. Nice to meet you both. Jocelyn, you take care, okay?
Okay, thank you.
You're welcome. Good job, Jocelyn.
Welcome to the Healthy You podcast from North Shore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm Jon Hillenbrand.
In the 1930s, it was a common practice for a doctor to go into a patient's home if they were too sick or injured to come into the medical practice. What if now in the 21st century, your doctor visited you?
Like you said, it's just incredible technology. I think if we thought about this even 10 years ago, none of us would have believed something like this would be possible.
Today we're talking about a modern twist on a long-forgotten medical tradition, the house call. And with us today is Dr. Nadim Elbawi, who is going to explain to us and introduce us to Tyto Care. Welcome to the podcast, Dr. Elbawi. What do you do at North Shore?
Thanks for having me, Carolyn. I am a family medicine physician. I've been here at North Shore for about 10 years, and I have the honor of chairing the digital-enabled primary care and chronic disease management task force.
Ooh, I didn't know that part. That's exciting. Okay, Tyto Care is a handheld exam kit that's used to enhance the North Shore video visit experience. This portable medical device, and it's a kit, allows you to capture physical exams, data like your heart and lung sounds, or ear and throat pictures, and share it with your provider. So using this information and other details provided during the visit, your medical team can make a diagnosis and offer a treatment and even a prescription, all from the comfort of your home. So stay tuned because we have a special offer for our listeners. You're going to hear more about that at the end of this episode and how you could get some money off an exam kit. And we'll also include it in the show notes. Dr. Elbawi, so we can't do everything with telemedicine, but there are a lot of things we still can do, especially with this new device. So let's go through this kit, what comes with it, and explain what each instrument does.
Okay, great. Yeah, Carolyn. So we'll open it up here, and one of the really neat features of this device is that we can perform a physical exam from the comfort of a patient's home. So with the otoscope tip, we can take a really close look at the tympanic membrane or the eardrum. It can help us diagnose ear infections, for example. And we can also look at the ear canal, and sometimes kids or adults will have an outer ear infection, and that helps us take a look at that as well.
So the otoscope is, let's explain exactly how this is done. So the parents at home, they open up their kit, they have a digital camera, right, that comes with it, like a little square box, and then the otoscope is that thing you could think of with the pointed type of plastic thing that looks into the ear.
Exactly.
And then that's through fiber optic cables or whatever is transferred to your screen.
That part I can't explain.
Yeah, I don't know either.
That's magic.
We'll just go with it.
But no, the device absolutely has the ability to add these peripheral attachments, and the otoscope tip, this black tip that you're used to seeing in the doctor's office, is one of those. And so you're able to attach that on as one of the peripheral devices that comes with the kit, and that's how we're able to take a look in the ear.
And it's cool. It looks like a little device, almost like a tiny iPhone that you attach things to. It's cool.
Is the picture you're seeing clearer than in person?
It's a great question. From the experience that we've had and our immediate care clinicians, they've said actually that using this to visualize the ear is actually better. The light that comes off of this device is very strong, and if positioned appropriately, you can get a really, really good look. So yeah, actually it is better.
That's cool.
Yeah, I wondered about that. Okay, so what else is in this kit?
All right, so the other really neat thing here is that we can switch up the peripheral to include something to help us auscultate or take a listen to the heart and lungs and the abdomen for bowel sounds. And so we can get a very crisp and good transmission of the sounds that the lungs are making to make sure there aren't any abnormal sounds. We can make sure that the heart sounds normal as well, and then we can listen to what the bowel movements sound like.
So it's a stethoscope?
Essentially, it's a stethoscope. Exactly.
Okay.
Yep.
Cool. And you just ask the patient to hold it over their heart or their abdomen or whatever.
Exactly. So what's really neat about this device too is that it really guides them through the exam so that they're not confused as to where they should be putting things to maximize our ability to listen appropriately to different parts of the heart and the lung.
Well, which is good because you could see them too, so you could say
Exactly. You can guide them.
Yes, guide them. Yep. Okay. And is it the sound compared to using a stethoscope in the office same or
very comparable? Yep.
Okay.
Exactly.
Perfect.
Yeah.
All right. So what else is in this kit?
So the kit itself has a basal thermometer, and so the patient or the parent's able to put it in front of the forehead and get a very accurate temperature reading. And then because it has a digital camera as well, we're able to look at the skin. So if there's a concern for rashes, it's a very good way to look at that. And then what's really neat is that it also comes with a tongue depressor peripheral, which allows us to look at the back of the throat, see if it looks like perhaps a patient has strep or anything else that might be causing a sore throat.
So what are you missing? Because I know having that patient, especially a child, in the office, there's something there that you would know, be more in tune with than I am, but what is missing? Yeah,
so on one hand, I think kids are more comfortable in the home environment, right? So if the parent is kind of making this almost like it's a toy and guiding them through that, we get kids squirming around all the time when we're trying to look in their ear. But if the parent's doing it, the kid is much more comfortable. So I think that's actually a benefit. But then many physicians and clinicians will tell you that not being able to visualize face-to-face the patient can take away a little bit from some of the cues when a kid looks, for example, toxic is what we use when they're really sick. And you can gather some of those cues from a camera, but not always kind of just by how maybe listless they are or how sick they look. So that's missed. And then, of course, being able to palpate or touch, feeling the neck, pressing different parts of the abdomen to really get a sense of where they may have localized pain. So that is the piece that is missing from this.
2.0 maybe it'll come out.
Yeah.
Well, I would think it would be different seeing people in their homes because, a lot of times you get to see where they live, what the conditions are there.
Yeah. That's very true of telehealth in general. Yeah, is that you get a glimpse into the home. And I think if we use it the right way, that can be very telling and helpful. I mean, you can even imagine walking through someone's pantry with them. That's not something you can do. Or you forgot to bring your medications into the clinic. Show me what you have, what you're taking, just so we know that you're taking the right medications. And so the ability to have a glimpse into the patient's home has a lot to offer as well.
Oh, that's a good point. All right. So what are some of the conditions that can be diagnosed with TidalCare?
Yeah, so ear infections, sore throats, we can try to figure out the cause of a fever. Of course, there are many causes of fever, but using these tools that allows us to do a physical exam will allow us to explore those causes. Cold and flu symptoms, allergies, pink eye. If a patient has nausea, we can talk them through that, but also do an abdominal exam, again, just through listening. Constipation, asthma, as we listen to the lung sounds. Bronchitis, similarly, will create different lung sounds. Upper respiratory infections, bug bites, and other common skin conditions that the camera will enable us to see. But most commonly, we're seeing ear infections and strep throat and things like that.
That is a godsend.
Yeah. It is.
I mean, it truly is. When I was a parent, because you kind of have an idea of what's going on, but just the hassle of, I have to get in the car, get them in the car, get them to the office, take off from work. And I wish this was around when my children were younger, because it's so convenient and so high tech and good.
It's incredible, right? I mean, and now when you think about it, infection risk and control is another concern, right? So if you're bringing your other healthy kids into the office, our offices are very safe. We follow all the right protocols, but at the same time, you never know. Someone might cough on your child if they have their mask off for a second, and all of a sudden now they're getting sick too, just having come to the doctor's office with their sibling. So there is this safety aspect of it as well, in addition to the convenience, and trying to get 1, 2, or 3 young kids into a car and into the doctor's office isn't always easy. So
I wonder if it reduces the white coat effect, where people have, higher blood pressure, higher heart rate, because they're nervous about going to the doctor.
Yeah, no, I agreed. I think especially for kids, but definitely some adults, they're going to be comfortable doing this and talking to a clinician from the comfort of their home. Yeah. Is
this something that people can just use on their own without doing a televisit, or what's your thoughts on that?
It's a little bit more difficult. So the Tyto Academy allows the consumer, so to speak, to use this and kind of take a look and play around with it. But after that, we really use the North Shore Connect as our portal for accessing the features of this device.
Yeah, and also you get the benefit of the analysis from a trained physician.
Exactly.
Yeah, that's great.
So you've been using it with your patients, and what has the reaction been from some of them, if any?
Yeah, I mean, like you said, it's just incredible technology, just the awe of the technology. I think if we thought about this even 10 years ago, none of us would have believed something like this would be possible. So there's there's gratitude for the convenience of the tool. That is by far the most overwhelming feedback that we've had. And just the ease of use and the how neat the technology is. Those are the two biggest things.
What has been reaction from some of the kids? Like, are they still squirming around, and are you get a wide range? Or?
Yeah, wide range, but a lot of the kids, again, whereas in the office they may be really squeamish, they are almost looking at it as if it's some toy that their parent is playing with them at home with.
Plus, they're probably so used to it. Like, this is probably expected almost of this
right,
generation.
They're like, why wouldn't it be like this?
Right. Yeah, exactly. Exactly.
We're wowed by it.
We're wowed by it. They're like, this is like, this is nothing
yeah,
to me.
Yeah, exactly. There's your face, honey.
Does it work with the children's cell phones?
Right.
Right. Can they call up on their own?
Right. What's the age limit?
Yeah.
I'm 3.
Pretty much.
Can I dial in?
Yeah.
How has this device changed your life as a working mom to 2 small children?
When one of them is sick, I have to figure out what to do with the other one. So that's one challenge. Another issue is loading them into the car. Just getting them in the car, getting them there. This is just a huge time saver. I also find myself chasing my kids around the doctor's office, trying to make them not touch anything. So that kind of takes a little bit of stress. Tyto Care takes the stress out of the doctor's visit, I think.
When my children were younger, most of my anxiety was not about the illness, but was about, do I have to call in sick again? I just wish this was around when my kids were younger.
Right. And, there have been times where I've just felt unreliable as an employee because my kids are sick and I have to get them to the doctor and, figure out what meetings I'm missing and can I miss these meetings? Can my husband cover? It's stressful. It's an added stress. So this is definitely a really handy item to have in the parenting toolkit.
Mm-hmm.
Televisit.
So how do you think this technology will affect the doctor-patient relationship?
I think there are certain parts of our population that prefer convenience and access. And so to those, it will be exactly what they want. For others, you lose some of the cues that you really appreciate when you're face to face. And so I think for those of us clinicians and patients who value that, it's exactly what we all feel when we're wearing masks. We are missing out some of the social cues, and that part is unfortunate, obviously. So this is very close because it's a good picture and it's a camera, and you get a real good sense of what's going on. But nothing is like, the patient being right in front of you.
Do you have to put a limit on what this can be used for?
Yeah, so education is a big part of this, right? And so trying to be upfront as much as we can with our patients about what's an appropriate use for this, right? If someone's having chest pain, no, not appropriate, right? If someone's having something that seems to be more of an emergency or that we can't examine without physical touch, that obviously requires an in-person visit. So
yeah, you would think that you don't want parents especially to rely too heavily on it, but to use it for those examples, like those perfect examples that we talked about.
Right, exactly.
Is there a cost difference doing a televisit versus an in-person?
No, at this point there is not. So the state of Illinois has agreed to have parity, meaning for the next 5 years, I believe, they'll cover office visits at the same cost as they would a telehealth visit.
I bet that'll be looked at then again.
Yes,
probably.
Agreed. But it's interesting because 5 years is a lot of momentum building, so I can't imagine they would reverse that at that point.
Right.
Standard of care, essentially. Right.
Yeah.
Yeah.
And I was wondering, how accurate or reliable has the TytoCare been?
Yeah, so like we were saying
earlier. How good are you
earlier,
at diagnosing is what we're saying.
Again,
100 for 100.
if the condition is appropriate for a visit like this, it is very accurate. And again, the otoscope measurement is really something that is even better than in the office. We really can visualize the back of the throat in a way that, again, you've seen kids in the office that don't want the tongue depressor on their tongue, and they're really upset with that. But this device and the parent doing it's a lot more tenable to them. So it's accurate for the things we're looking for. Obviously, at the end of the day, medical decision making is much more than just the physical exam, right? It's all the symptoms and the presentation of the patient. And so we have to remind ourselves that the physical exam still, of course, has its limitations in terms of being the entirety of how we diagnose a patient. So the history matters a lot.
Do you know if there's any other additional devices coming out on the horizon, like something that can measure blood pressure or?
Yeah, great question. So Tyto is working really hard. They already have some devices that they can pair to their main device. So for example, pulse oximeters, those things that people put on their fingers to get the oxygen level, obviously something that we've seen with COVID. People are interested in that. So they have a device for that. They have paired up with Omron, which is a really good blood pressure cuff and machine that can give us blood pressure readings from home, a scale as well. And right now they're also working to partner up with other companies that can provide information like what's called peak flow and understanding how someone's asthma is controlled or not.
Wow.
And that's really just the tip of the iceberg. So this is the beginning of I think what we're going to see really an explosion of technology in the next 5 years or so, where we're going to be amazed by what we see and can do.
Exciting future.
Yeah.
Especially with that oximeter.
Yep.
I mean, if you have people with long COVID who are still hanging on, because we don't know when exactly this is going to end. So
yeah,
right.
Absolutely.
Do you ever incorporate watch information, like people who have advanced watches that look at the trends over time?
Yeah. So one of the questions, John, that we have to think about, and our committee is really thinking about as we think about wearables and remote data, is how do we incorporate that data in a way that doesn't inundate clinicians with just a lot of noise, right? So sure, I'd love to know your steps, and sure, I'd love to know your blood sugar reading at different times of the day, but what am I going to do with it? Who is going to digest that? And so we have to be very cognizant of how we do that. But our committee is looking at wearables and starting to think of use cases very specific to, when does it matter how many steps you take as you're getting ready for surgery, for example. We may prescribe for you a plan where you get yourself in maximum shape so that we know you'll do well through surgery. And there's good evidence that the outcomes can be improved with that. So a lot to think about, but obviously we don't want data just for data's sake. So we have to make sure we're taking it in the right way.
For our listeners, we actually have a really special offer where if they look in the show notes for this podcast, they'll see a link there that they can click on and order the TytoCare if they want to do that. And listeners can get $100 off the purchase if they use NS Podcast when they're checking out. And they'll also, if they register the device within 30 days after they purchased it, they will get a $50 Amazon gift card. So that's basically $150 off of the original price, which is $299.99. So that brings it much closer to something that's very affordable for a lot of people.
Oh, yeah, totally. And if a North Shore patient wants to get signed up with TytoCare, just visit northshore.org/TytoCare, TytoCare, to purchase a device, view video tutorials, and you can get answers to all the frequently asked questions.
And also, patients who have an FSA or an HSA account, like a health savings account, they can use that to purchase this. So then it's like even more savings because it's a tax-free purchase.
Yeah, and right now we should mention, too, that it's our North Shore immediate care doctors and our pediatric providers that are available for TytoCare visits.
Right. Just to review, the kit includes an infrared thermometer, a high-resolution camera, and adult and child-size adapters, which include a tongue depressor, an otoscope, which goes in your ear, and a stethoscope, which you can use to listen to things like your heart or your bowels. For capturing physical exam data like heart and lung sounds and images of the ear, throat, and skin conditions. Can you use this to look at like a mole or something like that?
Yeah.
That's pretty cool.
Yeah. Wow. All right. Welcome to the 22nd
22nd century. Yeah. Welcome to the future. We're all we all thought we were going to have flying cars, but we never thought anything useful like this.
So, you know what's funny? When I was little, I would catch those reruns of
the Jetsons.
No. Not the Zone. What, the Twilight Zone?
Yeah.
The Twilight Zone. And I remember this one episode. It was a white room, and there was a monitor in the corner of the room, and a face was on it. And I remember thinking to myself, "Oh, that will never happen." Yeah, like we're gonna be able to have faces on screens, and talk to people.
Oh, my
Right. Or the face on the watch, like video conferencing, on your phone. Like, this is never going to happen.
I know.
The technology doesn't exist and it never will.
Amazing.
Right. Here it is.
Yep.
But thank you so much for being
here. Oh,
here.
absolutely. My pleasure. Thanks for having me.
So interesting. Thank you.
Really neat. Thank you.
Special thanks to Jessica Jafari and her 5-year-old super cute daughter, Jocelyn, who you heard at the beginning of the episode. Jocelyn, you have a big future in radio or podcasting.
You've been listening to the Healthy You podcast from North Shore University Health System. We'll see you next time.
And as always,
Thank you for listening.
Good call. That's a nice one.
I love that.
I'm rubbing my hands together.